Hello, friends. So today I'll be talking on this newer topic, sustainability in quality improvement in healthcare. So for all the friends in intensive care, so this is a new sort of a domain that you will possibly keep hearing uh, and softer. So I remember maybe 10 years back, we started speaking about quality in intensive care. So it was very new at that point of time. Now it has become very innate to our understanding. So the now the new word that you will hear or being resonated more and more would be sustainability. And I believe this possibly should be spoken, respoken, and relearned in healthcare. And this question also should be possibly asked in every exam for every doctor to be equipped with the understanding of what sustainability is. So we'll just take you through the brief overview of this concept of sustainability. So what do we understand of sustainability as a domain of quality in healthcare? So when you look at the healthcare services, traditionally, it really looked at offering healthcare to an individual patient. So now thus paradigm has changed to offering healthcare to the whole of population. And it is not even limited to the whole of population, but delivering care to the patient and to the population, keeping future in mind. So that is what we understand by that. This is the ethos of sustainability. So delivering care to the patient and to the whole population, keeping future in the thought process and making this care sustainable towards the future. So that is what the whole concept of sustainability. And the reason why this word sustainability has become a lot more relevant is in the face of the COVID that we have faced, because we saw the healthcare crumbling during COVID and it appeared non-sustainable at that point of time. So that is why this has become a lot more imperative that we need to have sound understanding. The healthcare service, what we envisage is to provide the care to the patient for a significant period of time. And over the course of time, there would be an increase in the demand of healthcare. And this demand, increase in the demand in healthcare, would happen in the face of dwindling financial availability or the financial resources. So this is where the whole challenge lies. That's why we need to put emphasis on reducing the wastage and sustaining the sort of resources that are meant for the healthcare. So that this is what is the ethos. And one needs to understand all this will be happening within the constraints of the social situation that will be prevailing, which we saw in COVID. So what that means is the future of the healthcare, the elderly will be becoming more vulnerable because of reduced caretakers that would be available to look after the elderly and vulnerable patients, which is already happening because the COVID also showed, and even in this day and age with the working couples, even in a country like India, we have witnessed that there are no personnel available to look after the elderly vulnerable. So the whole social fabric is changing, and there is a constraint of social order to optimize or to deliver healthcare to the elderly people. And there, most importantly, we'll be talking a lot in this narrative about the environmental constraints, because our whole effort should be to reduce the carbon print or the carbon footprint or the greenhouse effect or whatever one understands. So we need to take care of the environment while providing the care through the whole process. So we need to reduce the carbon emission whilst we are advancing in our zeal to deliver healthcare. So that is the sort of understanding. And so there is a sustainable sort of a society which really looks at reducing the carbon emission by 80% in the years to come. So this is what we are looking at. So I'm sure most of the listeners here would know about the quality. So there are 7 paradigms associated with quality, and we are all aware of this. So when we talk about quality in healthcare, so there are 7 dimensions to the quality. So when we talk about quality, it means that we need to provide care with increased efficiency. So there has to be increased efficiency with which we need to provide the care. And the care has to be provided in a timely way. And we saw all this getting affected during the COVID. So the timeliness of the care also constitutes an important dimension of quality, and encompassing the ethos of safety and causing no harm to the patient. So that also is an important paradigm of quality. And Patient communication is also a very important aspect, or patient satisfaction. So how satisfied is the patient with the type of care that is provided is an important dimension of quality. And how effectively the care is provided constitutes an element of quality. And this is another important aspect which was troubled during COVID, the equity, because we know the equity of the care. Because if you look at the ethical principles which govern our healthcare, it is beneficence, non-maleficence, and distributive justice. Because this distributive justice or the equity of care was something that was significantly affected during COVID. So equity of the care also is an important dimension of quality. And the seventh dimension, which is a part of the quality, is sustainability. So the sustainability and quality are interdependent. And it is now re-emphasized, this sustainability, what we are talking, runs through all the dimensions of the quality. So sustainability becomes an integral part of the whole quality dimensions, and it is a part of the quality is what is being emphasized. And it is also shown that the healthcare of an individual and the healthcare of the population is dependent on the functional ecosystem that the care is being provided. And it is dependent on strong social networking that is prevailing. And it is dependent on the economic opportunity that would be available. So these are some of the factors that influence the healthcare of an individual, because you need to have a good ecosystem, and there should be good network of the healthcare facilities that are available to provide optimal care to the population or to the patient. And economically it needs to be viable, because there has to be economically the patient possibly has to be able to afford the cost of the healthcare. So that's what economic opportunity is, something that becomes important, which determines the health of the individual and the patient. So these are the three important aspects which influence the type of healthcare that is delivered to the patient and to the population. So with regards to sustainability, there is a talk on the healthcare service not only should limit to offering health to the patient, but rather it should widen its horizon to involve itself in good education, training, and employment opportunities, political empowerment, and other social determinants of health, which is good exercise, good nutrition, and minimizing the air pollution, or minimizing the or improving the air quality, or minimizing the carbon emission, and avoiding air pollution. All this becomes responsibility of the healthcare service. So gone are the days where healthcare service you only talk about of delivering health to the individual, but it widens its horizons to involve education, giving employment, even making policy at the governance level, and having an influence on other social determinants of health. So that is something that we need to keep in mind. So the whole tenet of the health service is to promote health, and in zeal to promote health, it is also to prevent disease. And by promoting health, so we know now as intensivists, our whole focus is not to treat as sepsis, ARDS, but rather we should extend our efforts to promote health in the community, so that the burden on ICU or the healthcare organization is mitigated. And this is what we saw in COVID, how by promoting health and preventing disease with vaccination, we could lessen the burden on the whole healthcare establishment, and together they facilitate reducing the cost. So then the question is, why healthcare sustainability is important. So there are two aspects of healthcare sustainability that are important. One is the practical approach. So the practical approach is where we provide high quality uh, care delivery, and which is sustained to the future amidst the constraints which we spoke about, constraints of social, economic, and environmental constraints, providing high quality care into the future. The ethical aspect of healthcare sustainability is to put in all efforts to reduce the climate change. So this is what the sustainability encompasses. So in whatever methods we're providing healthcare, we should have a thought in mind that we should put in resources and measures to reduce the carbon emission, and encompass all the determinants of health. So these are the two important aspects of sustainability. One is obviously to provide good quality of health amidst the constraints of social, economic, and environmental constraints. And the ethical one is to reduce the carbon emission and encompassing other determinants of health, which is employment, political empowerment, and we saw the nutrition, exercise, and education. So all this become the other social determinants of health. And there is also emphasis on community-driven health. So we saw this during COVID. Community-driven health is shown to improve outcomes. So the way we talk about it is to empowering someone within the community to become the custodians of health. So in COVID, if you saw the quarantine principle, so the apartment complex or the gated community, there would be a community which would be empowered within that apartments, who would possibly oversee that quarantine is implemented or established. So the community themselves getting involved in safeguarding the health is also goes a long way in improving the outcome. And this has shown to improve outcome, and it saves cost enormously, because this typically happened in COVID, where community were empowered to ensure that effective vaccination happened within their apartment complex, or effective quarantine happens within their apartment complex or within the place they stay. So that curtail the cost and improves the healthcare, and spreading the word and educating the other people within the community goes a long way in improving the health of the patient. And redefining value. So this is very important in sustainability. So the value is defined as the outcome that we achieve for the patient and for the population, so the outcome that we deliver to the patient and to the population amidst the constraints of this social milieu that is prevailing, the environmental factors and the economic factors. Despite all these constraints, achieving good outcome to the patient is what we call as value. And there is whole emphasis on maximizing the efficiency and increasing the value. And this happens by these two important things. These are the two important things one needs to remember. So the value to the healthcare improves, or maximizing the efficiency happens by avoiding under usage of overvalued interventions in the healthcare. So this is very important. Please just pay attention to this. So avoiding underuse of overvalued intervention and avoiding overuse of undervalued intervention. So there should be a balance between the usage of overvalued intervention and undervalued intervention. There should not be zeal to overuse one of, so overuse of any of these or underuse of any of these will curtail the value. So this is what, and having a good balance between this is what is shown to enhance the value in sustainability. And there is an emphasis on reducing the carbon footprint. So there is an emphasis, if we have to look at sustainable health, there is a carbon budget that should be incorporated within the healthcare. So what it simply means is having a carbon budget and curtailing the carbon emission has shown to significantly reduce the preventable disease or disease with morbidity like asthma, cancers, or cardiovascular disease, and so on and so forth. So the whole effort is to reduce the carbon print by creating a carbon budget, which has a bearing on some of the diseases. So now moving on to, so what does the inclusion of sustainability in quality and value mean for the process of quality improvement? So gone are the days where you look at healthcare as a doctor providing care to the patient, but it involves various other dimensions, like you have a nursing staff, you have ambulance services, you have the hospital organization. So there's a whole sort of an ecosystem that is developed, which are involved in the care of the patient. So it is not only doctor who is involved in the delivery of the care. And now the role of doctor is not to provide only the care to the patient, but it is also doctor has to be engaged in the quality improvement. So the responsibility of doctor is to continue to provide quality improvement, which is an ongoing systematic effort. And this quality improvement should be integrated with sustainability. So this is the current role of doctor that is being emphasized. So doctor's role is not limited to only providing help to the patient, but is also involved in continuous quality improvement, integrating the sustainable health also into the whole system. And this we call it as, before we used to call as quality indicators. Now it is called as sustainable quality improvement framework. So SUSQ is something that you will keep hearing. So I remember maybe 5 years or 10 years back, we started talking about a lot of QI, quality indicators, quality improvement. Now, this sustainability is something which needs to be integrated with quality indicator or quality improvement. And the word that we'll possibly start using is SUSQ, which is Sustainability Quality Improvement Framework. And there are different components for sustainability and quality improvement framework. So we have to set the goals. What are our goals to sustain this? And then one needs to educate oneself about the whole systems that govern the sustainability and quality indicator. And then one needs to engineer the continuous improvement in this sustainable. And one needs to ascertain by having goals, by educating, and by continuous improvement, whether we have had an impact on the sustainability and the healthcare. And sustainability is not a lofty aim, or it's not something imaginative, but it could be practically applied for continuous improvement, which we will show with an example. So it is not a theoretical concept, but this is something which can be applied practically. And there is a societies which are created on sustainable quality improvement to look at the sustainability as an integration, as a part of the whole quality improvement. So let's look at each one of them. So what do we understand by the setting goals in SUSQ framework, which is sustainability quality improvement? So the goal is quality improvement is to maximizing the sustainable value. And the way we maximize sustainable value is by maximizing the health gain, by reducing the cost to the patient, reducing the carbon emission, and by incorporating the social sort of a constraints that would be prevailing at that point of time. So alongst with this, we would sort of maximize the sustainable value. And there is an entity called resource stewardship, which needs to be adopted. So resource stewardship is the right patient, identifying the right patient and giving the right care to the patient at the right time. So this is another important word, possibly I would request intensivists to remember. So one is overusage of high value intervention or under usage of low value, or overusage of low value intervention, and this resource stewardship is something that I would expect intensivists to remember, which is the right patient, right care, and at the right time. So then studying the system. In the studying the system, one needs to look into all the inputs that goes into the healthcare and the output. And this is required to look at all the wastage that gets created from the healthcare and the potential assets that evolve from the healthcare. So this is something where you need to look at all the resources that get fueled into the healthcare input and all the resources that get fueled out of the output. And this may lead to a lot of wastage generation. So that is something one needs to keep a tab on and looking at the potential assets. And this is important to reduce the carbon emission. And the measures taken to reduce the carbon emission, possibly one has to put in a creative sort of a thought process, and one has to challenge themselves to radically change the way they work to ensure that carbon emission is minimized. So this is something which happens by studying the ecosystem in which one individual is working to see how best the wastage can be prevented and increasing the sort of potential assets. So they are put in this carbon hotspots. So when you look at the healthcare system, so you see there are a lot of areas where carbon hotspots, where there is increased carbon production. If you see the whole building, the way building is designed, that may be a potential source of carbon emission. And then you have this pharmaceutical prescriptions, all the pharmacy, all the drugs, so that also have an increased carbon emission. And then you have these medical instruments and equipments which are shown to have increased carbon emissions. So this is just a graphical representation of all the different areas within the health system. If you look here, there are paper products also, which adds on to the carbon emission. And there are a lot of these drugs which add on to the carbon emission. And all the fuels that are used, all the electricity that is used, all these are known to increase the carbon emission within the healthcare system. And it is important for us to recognize what are the carbon hotspots within the healthcare system. So in studying this sort of a system, SUSQ system, they have devised something as 7 capitals matrix. So one is the costing. So looking at the accounting and the cost involved for this. And the second one is to look at the healthcare, the expertise of the healthcare personnel and the motivation of the healthcare personnel and the time utilization of this healthcare personnel. So this is one dimension of the 7 capitals matrix. And the third one is the commitment with which a care is delivered to the patient and the skill set that is imparted to the patient and the compassionate care and the optimal treatment that is given to the patient also constitute one of the capital matrix. And extensive networking between the healthcare personnel is also an important aspect of improving sustainability. So important network between the doctors, nurses, and other varied specialities improves the care to the patient. And community involvement, which I said, so community centered sort of an approach to take care of the health of the individuals and the patients and reduce the burden on the healthcare goes a long way in improving the sustainability. And having social support groups and having charitable organizations affiliated also goes a long way in improving the sustainability. And having the infrastructure, so the way the building is constructed to reduce the utilization of air conditioning, to optimize the utilization of sunlight, and to improve the airflow. All this goes a long way in improve the sustainability. And incorporating the natural elements within the ecosystem. So optimizing the water and safeguarding the sort of the atmosphere and the air quality within the healthcare system. All this go a long way in improving the sustainability. So so let's look at the way how we can continuously improve. So there is the Center for Sustainable Health, which is created, which looks at prevention of, this has 4 dimensions. One is the prevention. Prevention involves promotion of health and reducing the deaths or minimizing the deaths. So promoting health and minimizing the disease is something that forms a part of this quality improvement or forms a part of this improvement of sustainable health. And reducing the need for healthcare or reducing the burden on the healthcare system is an important aspect of continued improvement. And empowering the whole community in improving their health also is an important aspect of continued improvement. And there is a lean process which needs to be incorporated. Lean system being incorporated in the healthcare is not to sort of waste any resources, and optimizing the available resources is the lean system. Most of the MBAs would have heard about the lean system, which involves minimizing the wastage of resources and optimizing the manpower effectively is the lean system, and measures to reduce the carbon emissions. So all these form the dimensions of improving for continuous improvement of sustainability and reducing the paper usage and reducing the water consumption. So they are also an important aspect of sustainable health. So we'll just take you through an example of how this sustainability can be incorporated into the healthcare with a practical example of asthma. So there is something called primary drivers and secondary drivers. So when you look at the actionable points, so you have this campaign against smoking, home improvement, and you have efforts to improve the air quality and reducing the vehicular exhaust. All this will lead to secondary drivers, which is reduction in the smoking incidence. So if you have extensive campaign on anti-smoking, so our understanding is that the smoking prevalence within the community is curtailed, and the improvement in the home possibly will reduce the utilization of air conditioning, which will add on to the carbon emission, and reducing the exhaust or reducing the air pollution by controlling the vehicular exhaust. All this have a bearing on primary driver, which is preventing avoidable lung diseases. So you can see how this whole ecosystem come together to prevent this lung diseases. So this is how the whole sustainability happens. And having annual checkups for the patient and having rescue kits and pulmonary rehabilitation. So this will reduce your optimization or utilization of the healthcare resources, which will improve the lean system, and it will empower the patient to look after themselves well and reduce the burden on the healthcare. If they go through this pulmonary rehabilitation, have a rescue therapy at home, and have an annual check, so it basically curtails and mitigates the burden on the healthcare resources. So this is how we practically implement the sustainability. And reducing the paper usage and reviewing of the inhaler use, and adhering to the guidelines and having the recycle of these inhalers, what it leads to is to reduction in the wastage production, and and adhering to the guidelines and reviewing the inhaler usage will facilitate optimizing the use of inhalers more effectively. All this will lead to your primary aim, which is to reduce the carbon emission. So you can see how practically the whole ecosystem is interlinked. So you start with anti-smoking campaign, but you have achieved in reducing the lung diseases and reducing the carbon print. And you have started with reducing the usage of paper, and you have optimized the usage of inhaler, and you have reduced the wastage, and you have reduced the carbon print. So the overall outcome will be improved sustainability with regards to respiratory inhalers. So this is how we work with this is how the whole ecosystem is interlinked and the sustainability improves. So this is the whole concept. So embedding sustainability into everyday practice. So there is emphasis that sustainability should be a part of every training and education in the healthcare, and there should be a culture that should evolve, which encompasses the resource stewardship, which I said resource stewardship is identifying the right patient at the right time and giving the right care, and not to waste the resources by overusing any of the high value interventions, or underusing the high value intervention, or overusing the low value interventions. And this is what we said. And there is a national quality board which talks about shared commitment to quality, where sustainability is integrated into quality indicator, and the adoption of sustainability quality indicator has to be a part of the whole curriculum is what is emphasized. And there should be an awards that should be given to any organization which adopts these principles of sustainability and reduces the carbon print. So there is an emphasis on awarding the organizations or institutes or the personnel who are involved in putting all these processes to reduce the carbon print. And the Royal College of Physicians talk about quality improvement with integration of sustainability. And there is more research that is needed for us to understand the tools, the drivers, what we call the primary drivers, secondary drivers, to achieve our endpoints and reduce the carbon print with good sustainability. So when you talk about intensive care, there are a lot of domains. So we have 120 quality indicators. So any quality indicator you pick up, you could put in actions, primary drivers and secondary drivers to achieve sustainability. Some of the key areas which I thought was very relevant in intensive care where sustainability could be adopted is antimicrobial stewardship. So this is an important area where we could put actionable points to achieve reduction of antibiotic usage and become more sustainable. And we could put sustainable actions in preventing central catheter related bloodstream infections or central line related, or reducing VAP or catheter associated UTI. And this sustainability concept can be put in homogenizing the whole care, because we understand there is huge knowledge gaps within our intensive care. So by putting all these principles of sustainability, we could possibly, there is a lot of heterogeneity that exists. Homogenize the care is what we can understand, and there is huge conflict within the ICU. So sustainability as a concept could be put in to do a lot of conflict resolutions. Most importantly, ICU is high cost, so we could put sustainability as a concept to mitigate and reduce the cost. And another important area is putting sustainability to the well-being of the doctors. So these are some of the areas which I thought was very pertinent, where the actionable points with primary drivers and secondary drivers could be put in place to make the sustainability a very practical sort of a solution. So I will just skip this. So this is about the bloodstream infection. So to conclude, so as you see, quality, if you look at the big circle, the sustainability is a part of the quality, is within the quality. And this sustainability is constrained by the financial implications and by the environmental constraints and the social constraints. So these together form the tenets of the whole aspect of sustainability. And sustainability should be a part of quality, and resource stewardship should be ingrained into the quality. Together, by encompassing all this, we have ability to reduce the sort of carbon print or the carbon emission, and we could avoid the social inequality. And having the lens of sustainability with quality is shown to have immediate benefit. So thank you one and all. So I would end with this quote. So sustainability is here to stay, or we may not be. So this is a new concept. I'm sure most of it, what I've spoken, would have appeared very new, but this is something which is here to stay.
So I expect every intensivist to read about it and try to see how the concept of sustainability can be integrated into every quality indicator that we adopt in ICU. And this is the way forward. So thank you, Vanita.